Good evening, everyone. Welcome to First Aid AMC Clinical. Can you guys hear me well? Like, is there any issues with the audio? You guys are listening to me?
Can hear you well.
Pretty well.
Yeah.
All right, very good. So I can see a lot of you are from First Aid AMC MCQ also. You guys just passed your AMC MCQ. So I can see many of your names in here. So welcome to the clinical part of your preparation and congratulations on passing your AMC MCQ. So just like your AMC MCQ preparation, First Aid is going to give you a comprehensive idea about your clinical preparation. I am Dr. Arshan Ahmed, and I'm going to be the main mentor for your clinical preparation. And along with me, there will be several other mentors who is going to give you a good idea to pass this exam. So the first part of tonight's session is just to give you an idea about AMC Clinical. And then we're going to talk about just a little bit. I'm not going to burden you with a lot of information tonight. So this is a free trial class for everyone. So you can also share it with any of your friends. If there is any group that you want to share the class, we are more than happy for you to do that. And it's just to give all of the IMGs an idea that how they can start their clinical preparation. And it's really, really important to know what's going to be your next step. So AMC Clinical is the last step of being a doctor in Australia. Many of you might even get a job with Part 1. Now, even though if you get a job with Part 1, you need to pass AMC Clinical in most of the scenarios. So AMC Clinical is a vital part of your journey to be a doctor in Australia. And there is nothing we do that's apart from that, you don't really need anything to just finish this step and being a doctor in Australia. So we will cover each and every part of AMC clinical preparation, and we provide a huge amount of collections, materials, notes, videos. So if you heard about us from your study partner, from your seniors, or someone who passed the exam, you know how much research we have and how much materials we provide to our students. And you must have also seen every month there are always, we get all the highest number of passing candidates in AMC Clinical every month. So if you have seen our First Aid AMC Clinical, the Facebook group, you can see a lot of people share their success stories. We share their success stories, and that's just the half of them. Half of them, they don't even allow us to share their name. So there is a huge amount of students who pass this exam from the course, and if we proud ourselves, so we pride ourselves to announce that yes, this is the course which usually shows the highest number of passing candidates in AMC clinical exam. And I'm sure you know that this is the hardest exam to pass. So if it is the hardest exam, how can we get most of the students who is passing in AMC clinical? It is simple in a way because not everyone can share all the updated guidelines. Not everyone can provide you the materials, which is really important for exam. And not everyone even work in Australia that they know what's really we practice here. So you need to have someone as your mentor who is currently working in Australia, because the guideline is one thing. Anyone can read a guideline and then just share that guideline with everyone. But when we practice in Australia, it is a huge difference between the practicing guideline and something written in a book. So the exam usually filter those candidates who is suitable to start working as a doctor in Australian environment. And for something bigger like that, you can't just go with any other courses or any other mentors who is not even working in Australia, or who just even passed their AMC clinical and they're searching the job in Australia. So we pride in a way that all of our mentors, they are currently working in Australia for years and years, all of them. We don't even allow any mentors who is not working in Australia. So every one of us, I have been working in here for 10 years. So some of our mentors, they are working here for 5 to 7 years. So they know what's been practicing in here, and they are up to date with the guideline. So that's one of the reasons we feel that, yes, that's why our candidates pass the exam in the shortest possible time. They pass the exam in the first attempt. And you know that passing AMC clinical exam in the first attempt is really, really hard, and it's a big deal. I passed my exam in the first attempt with 14 by 14 stations. And I understand that what's really the examiners look into a candidate when they're marking that candidate. You don't need a Australian accent to pass this exam. So as long as they can understand what you're trying to say, as long as you are making sense, you are good to go. You can pass this exam. And many of you initially will have a bit of difficulty with expressing yourself because English is not your language, but you can actually do it. So I have seen students who I sometimes struggle to understand their accent, but they pass the exam in the first attempt. I've seen like multiple students like that. Initially, when they started doing the role play with us, there were students who can't even talk. In between, they're talking in their native language. I've seen that. So there is no shame in that. It happens. And then eventually after the course, they did so much hard work. They worked on themselves. And those are the candidates who even passed their exam in the first attempt. So what I'm trying to say that this exam is not just about knowing a lot of things. They don't actually need a doctor who is already a specialist, because this is not a specialist exam. This exam is for junior doctors, and they are going to make you more knowledgeable. That's their job when you start working here. So the main thing is that, are you a doctor who has that ability to work in Australia? And ability means not only knowledge, it also means if you are empathic, if you are a professional person, if you show kindness, politeness when you are talking to a person. So exam actually just not about knowledge. It's not about finishing the stations in the time given. It's a lot. They don't say about these things when they mark you, but this is what really is important for passing the exam. So we mainly focus on your communication. We focus on how you can improve yourself to pass this exam. We just don't do our classes and then be done with it. We make sure you are improving. We make sure that if you are now 0% when you start the course, you will become 80% prepared when you finish the course. That's what our job is. The other 20%, you have to make sure you do it. So First Aid AMC Clinical, it's not a new course. All of you know that. Every year we run 2 courses, and each of these courses run for 5 months. So that's why we have a lot of students who finish our courses, because there is only two courses in a year. We can actually take 7, 8 courses in a year if we want to be greedy, but that's not actually our plan. Our plan is to make sure that if we take number of students under our wings, we're going to make them pass this exam. So that's why we try to keep it just 2 courses in a year. But those 2 courses, we make sure we give everything so that you can pass this exam. And that's, I think, together our hard work and our students' hard work makes it possible to pass this exam in the first attempt. Okay, so lots of babbling. Let's go ahead. So this is actually how is your AMC clinical exam will look like. So first of all, I'm going to give you a bit of idea about AMC clinical exam. What's the main part of your preparation, how to start your preparation, and then we're going to do just a psychiatry class today. And we'll just do a very important topic for exam, which is psychosocial history with mental status examination. Okay, and at the end, we will also do some question and answer session. So if you have any questions, we'll be happy to answer your queries. Now, tonight is not about AMC registration or AMC pathways. We take a class on AMC registration and AMC pathways, and that will be when we start our free 2-week sessions in January. So you know that this is the trial class, and then we also allow everyone to join our first 2 weeks of class. As I always say, that anyone can take a very good class, but if you join 2-week sessions with anyone, and if you are satisfied with that, that means that course is really good, because no one can fake 2 weeks free class, right? So that's why I always say that if you are joining a course, make sure you join at least initial 2 weeks classes with them, so that you know that who are the mentors, so that you know that if you are really liking the class, because that's really important. You are giving your money, you're giving your 5 months with us, and we want you to be fully satisfied before you start the course. Okay, so let's go ahead. I'm just going to put you as mute for the moment, and at the end we'll also allow you to unmute yourself, and then you can ask your questions if you like. Okay. And also, if you guys have any questions in between the class, you can write it in the chat box, and I always keep the chat box open on my side, and I will answer your queries when I can. So AMC clinical exam. AMC clinical exam, it's your last step to be a doctor in Australia. And this is really hard exam, but it is a doable exam. And I always advise to candidates that if you are not in a hurry, then finish AMC clinical exam before you search for a job. You can actually start searching for a job if you pass your AMC MCQ and you have a English test. You can, but after passing the AMC MCQ and English test, if you get a job, you get a limited registration in Australia. And you need to actually pass your AMC clinical exam to get the full registration. Some people do WBA, but we will discuss about that in the registration class. But WBA is very difficult, it's time consuming. And also passing AMC clinical when you are working in Australia for the first time in a hospital can be very daunting. So if you have time, I always advise to pass your clinical exam in the shortest possible time, especially if you are in your own country. You are not in a hurry, pass your clinical exam, because getting a job after clinical exam is much easier than getting a job after AMC MCQ. Now, AMC clinical exam, there is 2 modalities. One is your face-to-face and another is online version. If you are in the middle of your preparation, you are aware that next year, so far we know that all the exams are face-to-face. The AMC hasn't given any online date yet, as far as I know. But there will be some online date, but trust me, they will be very limited and it will be very difficult to get an online examination. Some of the people might be able to do it, but most of you will go for face-to-face exam. So we advise candidates to prepare for face-to-face because AMC clinical exam has been always face-to-face. It was during the COVID time when they had to change it to this online version, but Australia will never change this clinical exam into an online exam fully because it is really difficult to assess a candidate by an online exam. So there might be a bit of online examination, but most of the time the exam will be face-to-face because AMC has just opened a new center. So they built a new center. Definitely that's not for no reason. The reason is that they plan to increase the face-to-face exam. That's it. So my advice is for you that if you're not in Australia, or if you're in Australia, please start preparing for face-to-face. Yeah, it's in Melbourne. So and our course is mainly focusing on face-to-face exam for the next 5 months. When AMC opens online exam date, if we see that, yes, some of you are getting online exam, then we will start a bit of online preparation as well. For the last 2 to 3 years, we did online examination preparation for our candidates. Just because the main modality of exam was online, there was barely some face-to-face. But before that, we used to do face-to-face exam preparation. And now we are again changing to face-to-face. Okay, so anything happens, we always update ourselves in a way so that it is convenient for our candidates and we have everything that we need. We can easily change into face-to-face. If we need, we can change into online. So everything is in our hand. We can easily do that. There is no problem. Now, for face-to-face exam, first of all, once you pass your AMC MCQ, you'll see that you'll be eligible to apply for AMC Clinical in your EPIC portfolio. Once you get that, you don't need to pass English test for appearing AMC Clinical. English test is only for job application. So when you register for AMC Clinical exam, the difference between registering for AMC MCQ and Clinical is that AMC MCQ, they give you the dates of exam throughout the year. And you can easily do that anytime you like. But clinical exam is different. The registration is also very much competitive. And you must have heard that sometimes people miss the exam for even 6 to 12 months because they don't get seat in the exam. So most of the time, the AMC usually opens the date for 3 to 6 months at a time. So now we can see that I think up to June, maybe they have opened the date. I can't remember, but AMC usually they give, so it's the amc.org.au. So if you know that page or that website, so make sure you go into that website every now and then and see that when the next exam date is going to be opened. So AMC usually will give that announcement at least 3 months before they open it. Yeah, right. So up to June is already booked. So usually, I think it's in February or March, they are going to open another few months. So the rest of this year, from July to November, So there is no exam in December or January. So from July to November, that exam time will be given in a specific date. So what it does, that AMC Clinical will open a date of registering for the rest of this year's exam. And whenever they give you that date, make sure that you go into that site as soon as it opens, because within a minute, all the exam dates will be gone. So it is so competitive that sometimes even within a minute or even 5 minutes, all the exam dates for 6 months will be gone. So it becomes very difficult sometimes to get into the exams even. Especially, it is more difficult to get the exam at the end of the year. Okay? So we always say that when you start preparing with us, our course is for 5 months. You need another 2 months to revise everything. And after 7 months, you should actually appear for your exam. If you could do everything that we have done in the course, then you are ready for the exam in 6 to 7 months. There are candidates who did not even need to finish our full 5 months, but they were able to go for the exam, even pass the exam. How so? Because when you join the course, we give you the recordings of our previous batch fully. So someone who has got exam in 2 to 3 months, they also sometimes join the course and they just finish the course as offline recording classes. So that's what sometimes happens, that sometimes you don't have much of a time, but you just have 2 or 3 months in your hand, and then all you do is to go through our recorded classes of the last batch, and you finish our course in your own time and you go for the exam. So we have seen lots of doctors who have done it and they have passed the exam. So there is that way as well. Now, in AMC clinical exam, once you got your exam date and you have got your registration done, there will be a specific date when you need to be in the Melbourne center. So the face-to-face center is in Melbourne. And if you are in Australia, you can easily travel and that's fine. But for those of you who are overseas, you need to also get a visitor visa to come to Australia during your exam time. So think ahead, make sure you prepare for everything. You need to have your visa done and everything so that you can actually come in here during the exam time. Now, let's say that your exam date is today. So you'll be going to the center in the morning, and in the exam center, there will be some people will be standing there to receive you, and they will take you to the exam room. Once you go to the exam room, they will give you a kind of a ID card, which you will be hanging on your, just on the neck. See this ID card? Something like that will be there. So you can see even one here. So, and then they will be also giving a locker to keep everything in like if you have anything like bags or something, you can keep it in the locker. Only thing they will allow you to take in the exam room is your stethoscope. You can't carry any watch. You can't carry anything else. Okay? So just your stethoscope is the only thing that you can carry. Once you do that, so there will be the examiners will like, or someone will just give you a little bit of idea that what's going to happen, and they will give you an idea that how the exam is going to happen as well. Then you will come into this room. In this room, you can see that there are 16 stations. And each of these stations will be written as, like, let's say station 1 or room 1, like that. And outside, there is a monitor like that. So there are 16 stations, plus 4 resting stations. So there will be 20 rooms in the exam. And in front of each of this room, one of the candidate will stand like this. After that, so each station is 10 minutes. 2 minutes is outside to read your station. So there will be questions on the screen, and then they will give you some task. Like, let's say a 60-year-old female patient coming to you with a sudden onset of confusion. Your task is to take a history from the patient, then give the mental status examination finding to the examiner. So that was your question, and those two are your task. In the 2 minutes, you are going to read that task and think about what are you going to ask to this patient. Then after 2 minutes, there will be a bell. Then you will go into this room. An examiner will be standing in front of the room. Examiner will greet you and they will ask your name and make sure that you are the right candidate. Then you will go into the room and examiner will introduce you to the role player. So there will be an examiner and a role player inside. You don't need to knock the door. Sometimes, see this handle, you can just open the door. Okay? So most of the time it is a little bit open anyway. Doesn't really matter if you knock or not. So once the examiner introduces you with the role player, you will start your exam. Yes, so you directly go inside at bell. Now, remember one thing. The time is 10 minutes. This initial introduction that you're doing with the examiner and also the role player is a part of your time. So you normally don't get, so 2 minutes outside and 8 minutes for your task, right? You would not get this full 8 minutes for your task. You usually would get 7 minutes, 30 seconds. So 30 seconds will be lost here. So when you prepare for your exam, when you do the role play with your study partner, make sure that do the role play in 7 minutes if you can. And this 30 seconds is just a bonus in the exam. So prepare yourself as if it is just 7 minutes. Okay? So in exam, then you will not run out of time. The problem is, and that is the hardest thing to get prepared, that you don't actually see the watch. You don't know how much time you have. So throughout this preparation, we are going to actually do a lot of role play with you. So 5 months, we do like a lot and role play. So you will actually get an idea that how much time you are consuming. And you will be doing role play with your study partners. And you actually get an idea that how much time you have after doing a lot of role play. So even though like it's been happening for years and years, no one can actually see the watch, but still we are passing the exam, right? So means it is possible. So don't get stressed about it. So usually, sometimes in the task, in between the task, they give you a bit of idea that your 4-minute time is up. So we will let you know that how that works later on. So after your 8-minute inside is done, there will be another bell. And that bell means that your exam is over for this room and you must leave that room immediately. Remember, after the bell, you should not continue your task. Sometimes what we do that we just, let's say we want to just give a thank you to the patient and the bell was wrong. That you can do. So when you are going out, you can just say, thank you so much. So that's fine. You can do that. If there is very important thing you missed, sometimes on the way to the door, you can say that. Some good examiners, they will consider that. Some will not. But if you continue for like 30 seconds after the bell, there is another student who is waiting to get into this room because this is just a clock running, right? So it's not fair, and examiner will be very angry with you and you will fail that case if you do that. So please make sure if your time is up, it means it is up. You need to go out. In that way, you will be rotating in each station. Okay? So 16 stations, out of 16 stations, 2 stations are pilot station. That means these are not scored. So we have got 14 scored station. Out of this 14 scored station, if you pass 9 out of 14, you pass this exam. So it's not really difficult because you can do 5 Ks plus these 2 Ks. So 7 Ks you can do wrong and still you can pass this exam. That's what's called motivation, right? So you don't need to pass 14 station. As long as you pass this 9 station, and even if you do few stations really, really bad, you can pass this exam. So what happens in exam that some candidate get very nervous. Let's say the first station is always the hardest station for everyone because they are very nervous. So they don't do really good in first station and they think that, well, that's over for me. And then everything else is also bad. So I want you to understand that everyone's first station will be bad. There is nothing wrong in that. You can't do really good in the first station. So that's also examiner know that. So they are a little bit more tolerable in the first station. But the thing is that even if you do wrong, don't think about that. Just go on because you can do really messed up in 5 stations and still you can pass this exam like in a really good way. So don't be overly optimistic, be practical for this exam. Okay? So we don't want you to get highest score in here. We want you to pass this exam so that it's done for all. So that should be your motivation as well, that what if I have done something bad? What if I couldn't even get to the diagnosis of this case? It doesn't really matter because I can still pass this exam. Okay? Okay, so that's why we write in here that don't worry, we have got you covered. So that's a bit of an idea to know that what's AMC clinical exam is going to be. Now, let's move ahead. So you can now actually ask questions about the exam. Let's see if you have any questions, and then I will be happy to answer about the exam.
Sir, excuse me, I have a question. Sir,
If you want,
what
you can even
resource?
unmute yourself.
Sir, I'm Tehseen, and I have
Yes, so
recently
Dr.
cleared
Aruj, they give pen and paper to write the positive points in the exam. We don't advise you to write a lot of things in the pen and paper, but I always advise to write the name of the patient, because if you call someone, let's say someone's name is John, and you are calling them that hi Richard or hi Rickard, so that doesn't really sound good in the exam. And because you are nervous, you tend to forget the name of these candidates. So always write the name of the candidates in the pen and in the paper so that you don't forget. Usually the name of the role player will be given. So when examiner introduce you with a role player, they usually say, so this is Sarah, and you can start your case. So examiner usually give you the name of the role player. Sometimes they also have a name tag, and if you forget about their name, you can look at the name tag as well. So no need to ask again. No, it's not needed that you need to confirm the name. So They don't give a prompt time in face-to-face exam unless in the task it is written that, let's say that number one task is to take history for 4 minutes. If something is written there, that means after 4 minutes, they are going to give you a prompt, and the prompt will be a bell. And that means that you should go to the next task. If it is not written about 4 minutes, 5 minutes, then there will be no prompt. And only thing is once you finish your 8 minutes, there will be a bell. Okay. All right. Now, to start your preparation for AMC clinical, your first thing is some of the research. You don't need anything except what we provide you in the course. You don't need to buy any book unless, like, you should definitely go through the AMC handbook of clinical exam. The soft copy of that will be provided by us. But if you are a hard copy person, then you can buy that book if you like. It's not needed to buy, but definitely AMC handbook of clinical should be read. So I would advise you to start reading that book once, like while you are waiting for the course to start. Apart from that, there will be no other notes, there will be no other research that you need to go through for this exam. Everything needed will be given by us. So the notes with updated guidelines, the physical examinations, and everything will be done by us. And that's more than enough for passing this exam. All right. So give that to us. We will make sure that everything is there for you so that you can just go through that and you can pass. Now, AMC clinical exam is not about just learning. It's all about how you are delivering it in front of the examiner. To deliver a AMC, like to deliver the best of your version, you need to do a lot of role plays. So role play means that I will show you one role play today, and then you will know what does it mean. Role play gives you an idea that how much time you are taking for a particular case. What are you doing wrong when you are doing a case? So you have to have some partners, same like MCQ, with whom you can do some role play. Every time when we take a class, we advise you to finish those the cases that we are doing. You just need to do a role play with your partner. There is nothing important than doing a role play for passing this clinical exam. So this is the vital part. If you can do role play of every case that we are doing, you will pass this exam without any doubt. Okay, so role play is vital. You don't need a huge amount of a study partner like MCQ. You need highest 3 partners. So there should be a group of 3 person, and that's it. Just do the role play of the cases that we are discussing. All right, now let's start with our tonight session with psychiatry. Do you guys have any questions so far? We don't need to do that, Dr. Jan. That do we need to ask about whether they are Aboriginal and Torres Strait Islander? That is for pesky exam. For AMC exam, we don't need to do that. Yes, Dr. Akila. So if your exam is in March, there will be access to the past class. Job circular is a different topic, Dr. MK. So there is different time. There is no specific time for that. We will discuss about that in our registration class. So they don't need to guide you what is next station. So in your ID that they give you, your name will be written and also the number of station you have started, that will be given. So let's say if your first station was 14, then you will just rotate in that way. So your next station will be 15, then 16, and then you will go to number 1 and you will just rotate like that. So they don't need to guide you, you will be just rotating to the next room. And there will be several other people in there. If there is any problem, they will help you. And how many psychiatric stations in the exam? 2, mostly 2. Do we get physical examination card? No, in face-to-face exam, you don't get card often. You need to ask the examination finding from examiner. And Dr. Shoaib, it is not difficult to find a role player. And once you join our course, there will be a lot of students who will also search for a role player. So you can easily find one from a course. Without a course, finding a role player is really difficult. That's right. But when you do a same course, then you get to meet with new people and somehow you will find someone. It is doable, but we don't recommend that. I think it is really difficult to pass an exam like this without doing any role play. No, there is no new edition for AMC Clinical Handbook, and it is not needed. And composition of the exam. So there is no specific number of cages based on the subjects. So AMC never follow any specific guideline, but most of the time we see that psychiatry 2 case, gynae and obstetrics 2 case, then you get pediatrics 2 or 3 cages, and then you get at least 3 to 4 physical examination cages, and rest of them comes from medicine and sometimes a collection from all other subjects. Okay? And they provide pen and paper for you to write anything, but it depends. We normally don't say that just write everything that you're getting. So positive points, if you feel you want to write it, you can, but it's just a waste of time sometimes. So the trial class will be free for today and also for the initial 2 weeks. I'm not sure whether you can postpone your exam date. I think if you postpone your exam date, then there will be you will not get any refund. So you can, but there will be no refund of that. Yes, you can do role play online. So online role play is enough. You don't need to go to someone's place to do a role play. All right, moving on. Now, let me start the psychiatry, and then at the end, we will come back to the preparation again. How that sounds.
Good.
So first thing is today our main topic is psychosocial history. So let's say we are discussing about a patient who is having some kind of behavioral disturbance, or they might be having some sort of psychiatric crisis or mental crisis. So whenever there is a psychiatric crisis or some kind of mental health issues, the first task in the exam is to take a psychosocial history. So today we are going to cover that, and also we'll show you how to take a mental status examination. So first thing so let's say the examiner has introduced yourself with a patient, and patient name is Sarah. So your time is going on, how you're going to proceed from there. So there is a conventional way that everyone does, and then there is an alternative approach we advise you to do. So you will go in and you will say, hi. So the conventional or everyone's approach, they say that, hi, Sarah, this is let's say Dr. Arshan. I'm one of the doctor in here. I can understand from the note that you are having some sort of behavioral disturbance, or from the note I can see you are really sad. Let me ask you a few questions, and let me assure you that whatever we are going to talk today will be between you and me, unless it is harmful to you or others. So every psychiatric history starts with confidentiality. No one is comfortable to share their mental health if you are going to talk about it to everyone. So confidentiality is the number one key steps in this exam. Previously, there was a lot of critical error in this exam. Nowadays, AMC Clinical doesn't have any critical error, but there are some key steps. When examiners listen to your station, they usually try to find out that whether you are covering those key steps. One of these key steps is confidentiality. If you don't give confidentiality in a psychiatric case, you will not pass that case. And most importantly, the role player will not give you information that you need. They will not even talk to you. They might just, like, they will say nonsense, and you will not be able to come to any diagnosis. And exam allow that. So if you don't give confidentiality, it means it's going to be a very bad case. So make sure you don't forget about this step in a psychiatric case. Now, this one is something lots of candidates use, and we don't like this approach because everyone uses that. So we ask our students to use a bit of alternative approach, which will be something like that. So, hi, Sarah, this is Dr. Arshan. I'm one of the doctors in this clinic. See, the first thing is introduce yourself, because a patient needs to know who you are. What if you are a security guard? Examiner doesn't know you. So the role player doesn't know you. What if you are a relative? Or what if you are just here just to mess up this patient? So if you don't greet yourself or introduce yourself with a role player, they don't know who you are. Even though it is an examination, think that this is a real person, think that this is a real case. Then you can pass this exam. So first you go in, hi Sarah, this is Dr. Arshan. I'm one of the doctors in this hospital. It's very nice to meet you. Sarah, I can see you are really sad. I'm so sorry to know that. I want you to understand that we're here to help you, and you can talk to me about whatever making you really upset. Sarah, sometimes things can happen in our life that can make us really sad and upset. But sometimes talking can help, and we are here so that we can give you the right direction. And please be aware that whatever you say here, it's going to be between you and me, unless it is harmful for you or others. I'm here to talk to you when you are ready. So now you can actually understand that which one will be more eye-catching to an examiner, this alternative approach or the approach that a lot of other students use. Definitely this alternative one. And if you have a good initial approach, you will pass this exam just based on this initial start, because your initial start matters a lot, whether an examiner is going to listen to you or not. As a human being, we actually make something in our head. The first thing you say, we actually think that, well, this is a good or bad candidate. Because we take a lot of exam, like we take mock exams. When we mark you, the first thing that comes into my mind that in the first few lines, I know whether I'm going to pass this candidate or not. And I'm sure it happens with any other examiners as well, because the first thing matters a lot. And it gives an idea whether you have been preparing or you're just here to know that if you can pass this exam or not. So use a good approach, because that makes a huge difference. Once you have started you have given the confidentiality statement, the next thing is when when patient will, at this moment, when you say something like that, patient might say that, Doc, I've been feeling really sad these days. So then you will say, well, I'm so sorry to hear that, but I'm glad that you are opening up with me. Sarah, can you please tell me how long this is happening? So first thing is duration. We always want to know how long this is happening because this gives us an idea that is it a new thing or it's been a long thing, or is it even to make some diagnosis, we need the duration. Because if you want to make someone, like if you want to make a diagnosis of major depression, you need at least 2 weeks of this problem. If you want to diagnose someone as a schizophrenia, you need 6 months of symptoms. So that's why duration is really important. So our psychosocial history starts with mood, sleep and appetite, and asking about the suicidal risk. And then we go to some of the other psychiatric questions. So let's start. So first question, how is your mood these days? Patient says, I don't know, I just feel really bad. Then you would say, so definitely find out how long. And then you also ask that, is there any time that you feel really euphoric and happy for a few days or weeks? What are you doing with that question is that you are ruling out mania or bipolar disorder. So if you get a patient who has low mood, that means likely to be a depression, the second question we ask is, first we ask about duration, and second we ask, is there any time when you feel really happy or euphoric for several days or weeks? Then we ask, how is your sleep and appetite? If a patient says, I can't sleep, so we always go in detail based on what patient gives us. So patient says, I can't sleep. Then you will ask a little bit more. So you will ask that, well, is it difficult to fall asleep? Or do you get multiple broken sleep at night? Patient says, no. Well, do you wake up in early morning? Yes. So is it hard to get into sleep after you wake up? Yes. So there is important information in here. If a patient has difficulty to fall asleep, that goes more with anxiety. Whereas if a patient says that I wake up in the early morning and I can't go back to sleep after that, that goes more with depression. And if a patient says I get multiple broken sleeps, we also ask that, do you get any nightmares? And nightmares is a symptom of acute stress disorder or post-traumatic stress disorder. So all of these questions we are asking is to find out a diagnosis, okay? If patient says sleep and appetite is good, then you don't bother about these questions. After sleep and appetite, we go for the suicidal risk. It's a must to ask questions in any psychiatric case. So first question is, do you think your life is worth living? If patients say yes, then you don't ask any of these questions. If patients say no, that means patient might have a suicidal thought. Then you would ask, well, do you have any passing thoughts of harming yourself or others? If patient says, yes, I have thoughts of harming myself, then you will ask, do you have any definitive plan? Do you have any previous attempt? Do you have access to any weapons? So if a patient has thoughts of harming, we want to know if they have a current plan to commit suicide, if they have had any previous attempts, and whether they have any access to any weapons. So these will be our back-to-back questions when patient has suicidal thoughts. After the suicidal risk questions, we go to hallucination and delusion question. Now, depending on the task, we sometimes add questions. So let's say the task is to take a psychosocial history and give the mental status examination finding to the examiner. That's it. There is nothing, no diagnosis or differential in the task. But if there is a task that you need to find out the diagnosis and differential, then sometimes we will add questions in here based on what we found so far. Initial questions will give us an idea whether this is a depression case, whether it is a bipolar or mania case, whether it is a case of schizophrenia, because these are the three most important ones. So based on our finding, we are going to ask some questions to make that diagnosis, because diagnosis is a task. Like if we think that patient has low mood, patient is crying in front of us, patient has lack of sleep, lack of appetite, patient has suicidal thought, that means this is likely to be a depression case. So in that case, you're going to ask all the depression-related questions. And we will discuss that in our course when we do some other classes. So depression has 9 symptoms, right? We normally remember by Psychiatry. And I'm sure you must have read that in your MCQ preparation, but still we will discuss that in other class. If it is a mania case, we are going to ask about all the mania symptoms, which has a mnemonic of Dick first. If it is a schizophrenia case, then we don't need to ask a lot because hallucination, delusion are part of that. So if diagnosis DD is a task, then some questions will be added in here before we go to the psychiatric questions. Does it make sense so far, guys? You are understanding? Brilliant. Moving on. So once you have done these initial questionnaires, your next question is, Sarah, now I am going to ask you some screening questions. And some of these questions can seem quite strange to you, but please be aware that these are screening questions. Now, this is very important to mention because if you don't and you ask the patient, do you see, feel, or hear things that others don't? Most of the time, the role player will confront you and they will say, what doctor, do you feel I'm insane? I'm just mental? So then you will be in a lot of difficult position. So make sure you say that I'm going to ask you some sensitive questions, and these are screening questions for everyone. So the first question we ask is about hallucinations. So do you see, feel, or hear things that others don't? So seeing means visual hallucination, feeling is tactile hallucination, and hearing is auditory hallucination. And very, very important part of your mental state examination. Then the next question is about delusion. So delusion, we have several delusion we need to ask, and we follow the mnemonic RCGGP. So delusion of reference, we have delusion of control, delusion of guilt, we have delusion of grandiosity, and we have paranoid delusion or persecutory delusion. So all of these delusions are important for exam, and these will be asked in the exam, whether you can find this out from the history. So for these 5 delusion, there are 5 questions. So first we ask about paranoid or persecutory delusion. So Sarah, do you think someone is spying on you or trying to harm you? So they usually become very paranoid. Do you think someone is controlling your thoughts? So that's delusion of control. Do you think people are talking about you? Delusion of reference. Do you think you are guilty? Delusion of guilt. Do you think you have some special power? That's delusion of grandiosity. Now, delusion of guilt is a finding of major depression, whereas delusion of grandiosity is a finding of mania. And others like paranoid delusion, delusion of reference, delusion of control, these are usually found in a schizophrenia patient. Okay, so these delusion questions should be asked. We also ask that, do you think someone is inserting or withdrawing thoughts from your mind? Do you think your thoughts are being broadcasted in TV, newspaper, or radio? So this has names. So it's called thought insertion. This is called thought withdrawal. And this is called thought broadcasting. So these are also findings that we look for in a patient, especially under the delusion or thought content. Okay, so we have asked about hallucination and delusion. So this is very, very important, especially if this is a case of schizophrenia. After that, we ask insight, judgment, and cognition. For insight, we ask, do you think you need some medical help? Someone who has no insight, they will say, no, I don't need any help. I am messenger of God, so God will help me. So that's when we say that patient doesn't have any insight. So ideally, a mania patient or a schizophrenia patient will have loss of insight. To assess their judgment, we ask, Sarah, if there is a fire in this room, what are you going to do? Now, if Sarah doesn't have judgment, she will say, nothing, I will just stay in the room because fire will not touch me. If someone has judgment, what they will say? They will say, I will just run. So it's important part of our assessment. Then we check the cognition. So when we check the cognition, we check if a patient is oriented to time, place, and person. So for time, we ask, do you know what is the day today? Do you know who I am? That's person. And do you know where are you at the moment? That's the place. So time, place, and person, that's for cognition. So after we have asked about insight, judgment, and cognition, the next thing is asking about HETS and SADMA. So HETS is a mnemonic for a lot of things. So, but we don't need to go through all of them in every case. There are a few things that's really, really important in HETS. So first of all, the most important thing is home situation. After that, we have E. So E for education or employment. So we ask about their work situation. We check their activity, if they're active or they have lost interest in everything. D for drugs. S for social activities. Sometimes we also include social support. And another S, we include sexual intercourse or sexual activity. Now, sexual activity not important for most of the case. Drugs and alcohol will be asked in SADMA, so it's not important. In HETS, the only thing that we ask is home situation, work situation, and support. So just ask this patient, how is your home situation? Who do you live with at home? Do you do any work? Is there any stress at your work or at your home? Do you have enough support? This is very important because it gives us an idea about the personal things of a patient. And that's always important in a psychiatric case because someone can be depressed because they might have just had a breakup with their partner. Maybe someone died. Maybe someone having a lot of financial issues. So this gives us a lot of perspective that why a patient having a mental struggle. So HETS is really important. Then we ask about the SADMA. SADMA is mainly about smoking and alcohol. And sometimes we ask about the medication. So do you smoke or drink alcohol? Any other recreational drugs? Do you take any regular medication? Ask about the past medical history and family history, and you can finish the history. So any other past history of any mental condition, any other medical history, any family history of mental condition. Sometimes we also ask about some organic cause. So most of the time, hypothyroidism or hyperthyroidism can mimic a psychiatric condition. Sometimes if patient having a significant respiratory tract or flu-like symptoms, that can also be, a patient can become a bit of psychotic. Head injury can be a possibility. So we just ask this question to rule out common organic cause which can mimic a psychiatric condition. So have you noticed any change in your weather preference? So you know that thyroid patient, if a patient has hyperthyroidism, they don't like hot because they feel very hot and sweaty all the time. So change in weather preference is important. Any recent head injury, any flu-like symptoms. Now, this is not super important. If you are running out of time, you can forget about it. So after you finished your family history, then you will just say, thank you, Sarah, for all the information. I'm going to talk to my examiner and then I will come back to you. So that's the history. So you can understand that history can be quite big in here. That's why the task is usually take a psychosocial history and give your mental status examination finding to the examiner. So to summarize the psychosocial history, and then I will ask you if you have guys any questions. So the first step is confidentiality. And the second one is we start with mood, sleep, and appetite. We ask about suicidal risk. And then we ask hallucination, delusion. We ask about insight, cognition, judgment. HEDS, SADMA, past medical history, family history, organic history. Okay, so that's your psychosocial history in most of the psychiatric cases. Remember one thing, that when we take our course, our main focus is to make your preparation smart and concise. So most of the time, our history will be same for all the cases. We just include or delete few things based on the history, based on the questions, but your history format will be same for many, many cases. So we use the same format for 10, 15 cases. So you don't need to memorize 15 questions separately. All you need to do is get an understanding about that history, remember the history, and you can utilize that history for a lot of questions. And you will see how we do that in our next class when we do the MSc role play. So your first task is done. That means you have taken a history, and from the history, you will get some kind of positive findings. And that positive finding will be utilized when you present your MSc finding to the examiner. So how we present MSc to an examiner, that's what we're going to discuss now. Do you guys have any questions so far with the psychosocial history? So delusion questions. So you can see that that's RCGGP. So we ask about if someone is spying on you, if someone is controlling you. Do you think people are talking about you? Do you think you are guilty? And do you think you have some special power? Okay, I know, Dr. Pratik, it looks a lot. I know. So don't get scared because it's the initial discussion. And when we do the discussion, we take a lot of time to discuss a thing. But when we start doing the role play, you will see it is a doable thing. And it can be done in 7 minutes, 30 seconds. So you don't have any questions, I understand. Moving on to MSc format. So in the MSc format, we follow this mnemonic, which is aseptic J3R. Now, what we advise you to do when you get into this station, in front of you, there will be a pen and paper. I want you to just write aseptic J3R like this. So just write aseptic. So very quickly, just when you start your case, write aseptic J3R, and whatever finding you get during your history, just write quickly, because that's going to be helpful when you are actually saying your MSc finding. Otherwise, you can easily forget the findings. So aseptic J3R is a mnemonic that we use when we present the MSc to an examiner. So A for appearance and behavior of the patient, S for speech, E for emotion, which mainly the mood and affect of the patient, P for perception, perception includes that hallucination question, T for thought form, another T for thought content. Then we have ICJ, which is insight, cognition, judgment. And then we have 3R. So aseptic, 3R. 1R is for risk, rapport, and reliability. So these are our main things that we need to include when we present the MSc. I'll just go back to the previous page so that you can have a look again. So that's the MSc format. Now I'm going to discuss with you that what this involves and what are the things that we need to mention to our examiner when we present this MSc. So first of all, when we present MSc to the examiner, we say, "Dear examiner, I would like to present the mental state examination of my patient, let's say Sarah, a 35-year-old female who has been feeling very sad lately." So whatever is the history, you will just give a brief introduction. And then you will start with the aseptic J3R. So in the appearance and behavior, we look if the patient is well-groomed and if the patient is dressed appropriate to the weather. So you will be able to see the patient. So see if the patient is dressed appropriately, if they are well-groomed or unkempt, if they are cooperative or not, whether they are maintaining eye contact. Patient who is depressed, they will not maintain eye contact. They will just look down. Then whether they have any abnormal body movement or posture. Like patients who are depressed, they usually sit like a stooped posture, like leaning forward, looking down. And if a patient is anxious, you will see that they are very fidgeting. If a manic patient is in the room, you will see they're just running around, very restless, agitated. If it is a patient who is having schizophrenia, you might see that they're looking at the ceiling as if they can see someone or as if they are hearing someone's voices. Then you would mention that your patient looks distracted and seems to be responding to some unseen stimuli. So in the appearance and behavior, whatever you see in a patient, you need to mention that. Okay? So in the appearance behavior, you mention whether the patient is dressed appropriate, whether the patient is well-groomed, if the patient is maintaining eye contact, any abnormal body movement or posture. Try not to miss anything really important in the appearance, because that's a really important thing. Because if there is a schizo patient and they're showing you that he's looking at the ceiling as if he can hear someone's voices, and you did not mention that in here, that's a negative mark, or it's not usually a good thing to miss. So you have done your appearance and behavior part. Next is speech. When you talk to the patient, you will get to understand whether the patient is talking in a normal rate, volume, and tone. If it is normal, then say patient's speech is normal in rate, volume, and tone. A depressed patient will not have a normal volume. They will be very slow and monotonous, which means that if you ask, how is your sleep? They will say, so they will not answer immediately. They will say, not good. So see that very slow, monotonous, every word, they will take some gap. That's depression. If it is a manic patient, if you ask about any questions, they will answer very rapidly and pressured. So rapid pressured speech is usually found in a mania patient. Okay? So taking pauses in between depression, if it is a disorganized speech, like if it is a very severely psychotic patient, you will not understand anything they are saying. So that's disorganized speech. Normally in exam, they don't give it to you because you need to understand the patient to give the MSc finding. So it's usually not given. So in this speech, you will be looking for whether the speech is normal in rate, volume, and tone, whether it is a slow and monotonous, or is it rapid and pressured. All right? So after the speech, next is E. E for emotion. In the emotion, we look for mood and affect of the patient. So remember, when we start the case, we ask, how is your mood these days? Whatever patient says to you, if patient says, all right, you should write it in your paper that patient has said all right, because that's the mood. So whatever patient will say, you just say that according to the patient, his mood is all right. If patients say, I'm very lonely and sad, that's the patient's mood. So mood is what patient says, and affect is what you observe in a patient. Let's say, when you ask the patient that, how is your mood? Some patients who has depression, sometimes they just don't care. They say, yes, I'm fine. But you can actually observe that, no, this patient is not fine. He is depressed. So then you will say the effect I have observed is not congruent with his mood. So if patient is saying that I'm feeling low, and when you observe the patient, it looks like that, then you will say, yes, the effect I have observed is congruent with his mood. But if a depressed patient saying, no, I'm fine, but when you observe or when you are talking to that person, he doesn't look all right, then you would say the effect I have observed is not congruent with his mood. All right? Does it make sense, guys? What is mood and affect? And Dr. Madhu, the assessment will be done on both history and MSc. Everything that you do is being assessed. Okay, so after emotion, the next is P. So far we have done ASE, right? So next is P. P for perception. So if a patient has any kind of hallucination, you will just say patient has got visual hallucination or auditory hallucination. After perception, we have two T. So in the T, we have thought form and thought content. So if you can understand someone's speech, or if you ask a question and patient answer that question appropriately, that means their thought form is fine. And the normal thought form is called linear thought form. And in exam, most of the patients' thought form will be linear because they will be answering your questions. But there are some abnormal thought form. One is loosening of association. Then there is tangentiality, circumstantiality. There is concrete thinking. And then there is flight of ideas. So what are these? So loosening of associations means that you have asked a question to a patient, and patient is not answering that question. They're just giving you lots of information, but you ask the patient, what's your name? And patient saying, Like my father's name is this, my grandfather was this. Well, my grandmother was a very good cook. And also my aunt knows how to swim well. So he will be just going around and around, but never answering your questions. That means they're loosening association. Everything they're saying doesn't connect with each other. So that's called loosening of association. Subtype of loosening of association is tangentiality and circumstantiality. So remember, circum means circle. So you asked a question, patient said a lot of things, but at the end, he came back and answered your question. That's circumstantiality. And tangentiality means you asked a question and he just went on and on and on, never answered your question. Okay, so that's part of loosening of association. What is concrete thinking? Many schizophrenia patients, they don't understand some specific question, or their thinking becomes very concrete. They don't understand proverb. So let's say, how do you feel? Patients say, I feel with my fingers and toes. So this is called concrete thinking, right? But patient should have said that, yes, I feel fine. So concrete thinking is a part of schizophrenia. Now, this usually I haven't seen a lot of this example in the exam, so it's not must to remember, but again, it's important. You should know what these are. Flight of ideas. Very important. You can see this in a manic patient. Sometimes, mania patient, when you ask a question, they will just jump from one topic to another. But even though they don't have much of a connection, but everything that they say has a bit of connection, just a small amount, but they're just moving from one topic to another. Like you said, that let's say if we have some example in here. So let's say you ask the patients that, how was the movie? So patients say, oh, I loved that movie. I'm going to watch a movie with my mom. My mom adores me. Now, what's happening in here? Normally, if we ask a patient that how was the movie, patient will talk about the movie mainly. They will not jump from one topic to another. But flight of ideas patient, they will just jump. So I loved that movie. And then he came to like, I'm going to watch a movie with my mom. Not that movie, watch a movie with my mom. And then my mom adores me. So see that jumping from one topic to another, but every topic has just a little bit of connection. So it's a rapid shift in conversation topics, but it's still just a small amount of connection in between. That's called flight of ideas. Like this one, my father sent me here. He drove me in a car. The car is yellow in color. Yellow color looks good on me. The sky is blue. I have blue eyes. My eyes are watering. There is water everywhere. So you can understand that what this flight of ideas means. Okay? So that's a finding that we look for in a mania patient sometimes. Loosening of association and circumstantiality, tangentiality, they are same. So far we have learned about thought form, but most of the time in exam, you will get a linear thought form. Next is about thought content. Thought content includes mainly the delusion question that we ask, and also if a patient has overvalued ideas or any obsessional thoughts. So if a patient has obsessive compulsive disorder, the obsessional thought will be a part of thought content. In patient with eating disorder or body dysmorphic disorder, that's patient, they usually feel that they are very overweight, and that's why they start starvation, lots of exercise, vomiting themselves. That's overvalued ideas because they think they're overweight, but they are not. So all of these are part of thought content. So anything that you find in the delusions, you will just explain that in here. I'll show you how to exactly say all of this, don't worry. So that's thought form and thought content. And then we have got ICJ 3R. So you'll say if the patient's insight is okay, judgment is normal, and how is the cognition. So based on your questions, you will be able to give that information. And then lastly, we say if the patient is a low risk or high risk, are you able to maintain a good rapport or relation with the patient? And how much reliable this history was. So at the end, we will say, if a patient has got active suicidal or homicidal thought, they're always high risk. So you will say that my patient is in high risk because he has active suicidal thought. I was able to maintain a good rapport with my patient. The history given was not reliable. So I would like to take a collateral history from a family member. Remember that someone who has mania, who has lack of insight, psychotic patient, you would not be able to say whether their history is reliable. So you will always say that the history is not reliable and you would like to take a collateral history. And collateral history can be from friends, family member, or even sometimes police bring a patient to hospital and we can take a history from the police. If it is a patient who has depression, they have insight. So for them, yes, the history is reliable and you don't need to take a collateral history for them. If a patient was answering your all questions, then yes, you were able to maintain a good rapport. But sometimes psychotic patients might not answer your questions appropriately. And in that case, you can always say that I was not able to maintain a good rapport with my patient. He was quite restless and fidgety. So you can always say that. And that doesn't say that you are a bad doctor. Some patients might not answer your questions, and that means you are not able to maintain a good rapport, and that's fine. Okay? So that's where you finish your mental status examination findings to the examiner. You don't need to give a diagnosis and differential diagnosis unless it is asked in your task. Okay? Now, I'm just going back to give you an idea or an example of how we are supposed to present this to an examiner. So that's why writing the aseptic J3R and the positive findings in the paper is very handy in the exam. So you're going to say like this, so, dear examiner, I would like to present the mental status examination of my patient, Mike, a 35-year-old patient found by his partner trying to hang himself in the garage. In terms of his appearance and behavior, he is dressed appropriate to the weather, well-groomed. He was cooperative and maintaining eye contact with me. He was rather sitting in a stoop posture. There was no restlessness or frequent fidgeting. So we give positive and negative findings both. In terms of his speech, it is normal in rate, volume, and tone. There was no rapid pressured speech or disorganized speech. According to the patient, his mood is low, and the affect I have observed is also congruent with his mood. In terms of his perception, there was no auditory, visual, or tactile hallucination. His thought form was linear. There was no loosening of association or flight of ideas. As part of thought content, he had delusion of guilt, but no other delusion of control, reference, or paranoid delusion. He was oriented to time, place, and person. His insight was intact, or you can say his insight and judgment was intact. He is in high risk because he has active suicidal thought. I was able to maintain a good rapport with my patient, and the history given was reliable. Thank you, examiner. See that there is the thing that you need to say in here. And depending on the finding, this will be different. Let's say someone insight is not intact, you would say that insight is lost because patient said that he doesn't need any medical help. Then same about the judgment. Judgment is poor because patient, when I asked what he's going to do if there is a fire in this room, he said he's just going to stay. So based on the findings, we would just change this. All right. So that's usually your psychiatric psychosocial history. So you first find out the findings from your psychosocial history, and the second task will be presenting the findings to the examiner. And very rarely, especially it takes a lot of time even to do this, they don't ask diagnosis and differential, but if there is a diagnosis and differential, then yes, you need to make sure that you give the diagnosis and differential as well. And diagnosis and differential will be given to the patient, not to the examiner, unless it is written in the task. Does it make sense for everyone? Do you guys understand? Is it a bit difficult? It is difficult, I know. But trust me that if you can understand this, your psychiatry preparation is 40% done. Because this is one case in the exam. Most of you will get a mental status examination finding in the exam. So it's a really, really important topic. Okay? Any questions?
So should we start writing the
All right.
essay
So
here?
I would like to take a 5-minute break, and what I want you to do, I'll just keep this open, and I want you to just remember what we have discussed and try to just think about it or try to memorize if you can. And after that, I would like to do a role play with any of you. So see if any of you are interested, you can write it in the chat box and we will do a role play and we'll see if you, and you'll see that how this really works in the exam. Okay? And I would advise if someone who has already done a bit of preparation to come forward and do the role play so that others can also understand what it really means. Okay? 5-minute break, guys. Thank you. All right, everyone. So we can start again. So we were hoping that if any of you can do a role play. Dr. Min, you wanted to do the role play. So do you want to unmute yourself?
Yes, doctor. Hello, doctor.
Dr. Min?
Yes, doctor. Yes. Hello. Hello, doctor.
Can't hear you.
Yeah. Hello, doctor. Hello.
Oh, he is. Okay. Why I can't hear him?
Hello.
All right. Just give me 2 minutes. Let's see why I can't hear you. Okay. Let's have a look. Just a minute, guys. Dr. Min,
Yes, doctor.
let's see if I can hear you now.
Yes.
Not still. Okay. That's interesting. So you guys can hear him, right? Okay. Must be some other problem in here. Let me just try few things, okay?
Yes.
Can you hear me now? So, Dr. Min, try again.
Yes, doctor. I can hear you.
I don't know why I can't hear you.
Hello, doctor.
Okay, so that's fine.
Yes.
We would not do the role play today then. It's
Ah.
just because I don't know like why I can't hear you guys. So must be some kind of bug in here, especially in the Zoom maybe. So it's all right. We would do some role plays on these cages anyway. So that will be done in our first class of the free 2-week session. So in the free 2-week sessions, we do the first class is Psychiatry MSc role play. So in the MSc role play, we'll do all these cases, including the case that I was going to do today with Dr. Min. Sorry for that, Dr. Min. I don't know why we can't hear you. It must be something in my end. So now I'm hoping, guys, that you got an understanding about how these cases can be. And I'll give you an idea that one of the case that comes in the exam like this. So if you look over here, this is how a case looks like. So a nurse is brought by his wife as he was trying to hang himself with the rope since a patient died during his care. You have to perform mental state examination and perform the MSc to the examiner. So this is one of the cases where a nurse was brought by the wife because he was trying to hang himself. So even by looking at the questions, you understand that this might be a case where we should look for depression. So the case was like this. Yes, so there will be guilt and everything. So if you look over here, the positive point in this case was patient was sitting in a stooped posture, gloomy, well-dressed, no eye contact. Patient was having low mood, no sleep at night. Speech was slow and monotonous, has high suicidal intention, and believes he is guilty about killing a cat. That was a vet nurse. So in his care, a cat died, and he thinks that he killed the cat. And he has this delusion of guilt as well. No other problem, no hallucination, but his insight judgment was poor. Cognition was okay. So this is somehow like during your history, you will find out all of this, and you need to give this mental state examination finding to the examiner. Okay, so I hope this case makes a little bit of sense, but definitely it would be better if I could do a role play with you, but unfortunately, I don't know what's going on in my device. I'll have to check after the class. And when we do your first class of that free 2 weeks class, which is going to start from 15th of January, we will go through this role play, all of the cases that is important for your exam. Okay. And this class will be also uploaded in the YouTube. So we will share it in First Aid AMC clinical group, ideally tomorrow. So you can also have a look, make sure you go through these steps, make sure you know how to take the history and also learn about the MSc presentation. And then when we do the MSc exam case role play, you'll be able to do some role play with me. Okay, and I will show you what is the important thing that you are missing and how to improve yourself. Now, this was the main thing I kept for today to discuss with you. I hope you guys understood a little bit about AMC clinical exam and how to start your preparation. And as I say always, that the most important thing is to be ready for this exam. It's not about knowledge. We always say you don't need to be a highly knowledgeable doctor or a specialist to pass this exam. If you think that you can do it, you can pass this exam. Anyone. It's the people have this kind of myth that no, it's not possible. People don't pass this exam. It's hard to pass the exam. Yes, it is hard. If you are going to pass a exam in your country, which is the last exam of a particular, let's say, a some kind of like a degree or something, that last exam is always the hardest exam. In the same way, this one is also the same. It is hard. And not everyone is going to pass this exam, and that is understandable. You need to make sure that you are good enough to pass an exam like this. And with appropriate guidance, with appropriate materials, you can do it. So I want you to understand that if you look into our Facebook group, just scroll down and you'll see that doctors like you, doctors like countries like Pakistan, India, Sri Lanka, Bangladesh, these are the doctors who are our doctors who are passing this exam, right? Every month, 10, 15 students passing this exam, and most of them are first-time candidate. So, and many of them pass like 14 stations, 13 stations. So it happens. It's not impossible. So gather your courage, be motivated, and just do it. You don't think too much. Don't be too much hard on yourself. But the thing is, you have to give time. You can't just say that I will prepare maybe 2 or 3 hours in a day and I will not do any role play. I will just go through the videos Dr. Arshan is sharing and I'm going to pass this exam. That is not actually the way to go. You have to give a lot of time. You have to do these stages. And then, yes, I can say you can pass. Okay, so I'm going to discuss with you what the course is going to involve. Now, remember that we have updated this new AMC clinical course, which is starting from 15th of January 2025. The main update is we have changed the online version to face-to-face version because most of you are going for face-to-face exam. So we are mainly focusing on face-to-face format, including the physical examination. So today is the trial class, which you are attending now. Now, the free 2 weeks class will start from 15th January. The class time is usually 8:30 p.m. Sydney time, and it's usually taken in the Zoom. And Zoom ID and password will be given to your Facebook. So we're going to share a schedule of those free 2-week sessions. You'll get the full schedule in few days' time, and just make sure to join the classes as part of the schedule. We have a lot of recording of our previous trial classes as well in the YouTube, so you can always search it by writing First Aid AMC. Course inclusion. We cover everything that you need, so there is nothing else you really need to do apart from the course. So we will cover the full theory, and the theory we cover is based on a cluster-based approach, which means that we give you a history format, and using the same history format, you can cover 10, 15 cases, and it becomes really a smart and concise way of preparing. Because if you need to prepare for 300 cases, and all the 300 cases, you need to memorize the history and everything, it's not possible. You will just mix up everything in the exam. But those 300 cases, we can make it in a cluster of maybe even 50 to 100 cases. So it becomes so easier at the end if you can remember the clusters that we are doing in the theory. We also do role play based on those theory classes. Like if we do a psychiatry class like we have done today, the next class is role play on this topic. Not only that, we do a recent 5 years sample questions discussion, but we will mainly focus on 2025 sample cases when we take your classes. So the role play will be based on that. But in your portal where you get all the materials, you'll be given all the last 5 years sample questions role play classes that we have taken, which is like a tremendous materials which no courses provide. Even the course which is highly expensive, like you'll see courses coming under 5,000, 10,000 Australian dollar, they don't even provide the recording of those classes. But we provide 5 years classes to our students without any charge, without any fee. And what it does is that we take role play classes based on the 2025 cages, but even you can get to see the previous cages discussions as well. And that's a lot. You don't need to even go through 5 years. All you need is at least a 1-year cages and you will be fine for the exam. So we take 1 to 2 role play classes every week based on the important cages. So as I was saying, you get video of our role play sessions. And currently we have 160 role play videos of our previous batches. So that contains a huge amount of case discussion. Physical examination is a vital part of your clinical preparation. If you're a beginner and if you want to pass the exam, you need to be good with physical examination. We take 1 month fully for physical examination. There will be a course which just gives 2 or 3 classes on physical exam, which is not enough for this. We take 9 to 10 classes on physical examination. And each of those classes sometimes takes 3 hours, even 3.5 hours. So it's a huge amount of discussion we do on physical examination. And we try to make sure that if there is any kind of confusion, we will show how to do the physical examination on a video. And also the way that we share the physical examination with you, you will understand each and everything that how to do it on a person. We take online mini mock exams, and definitely there will be classes on communication skills and patient-oriented approach. We give recordings of our classes. All the class that we take, the live class will be recorded and it will be given to the portal, and you will get 10 months access to those videos, which is a lot. You get all other materials in the software until you pass this exam. Like all the notes and everything will be there until you pass. We also discuss, few discussion will be there on how to job hunt, CV selection criteria, RMO campaign, APRA registration. So there will be some discussion based on that. We also, you can, if you're a member of any CPD home, RACGP, ACRAM, or any other CPD home, you can add our classes and you can even claim 150 points because we take at least 65 classes in 5 months. And if you just, even if you just do 65 into 2 hours, it becomes 150. But most of our classes are like 2.5 hours. You will also get a course completion certificate, which you can use as a bridging course. Again, if you don't have 5 months, because maybe you have got your exam date in March, April, we will provide the last batch recorded sessions, and you can finish it in your own time. The cost is $899 plus 10% GST, which is our GST fee. 2 installations are available. So you will, if anyone have any kind of financial problem, you can pay half at the first and half in the second month. Course duration is 5 months, and the classes are ideally 3 days a week, but sometimes it can become 4 days a week. All classes are live classes, but if any of you, if you have, like, definitely you are working in hospital or something, you might not be able to join the live classes. Remember, half of our students are just solely based on recorded classes. They don't come to the live sessions because they can't manage the time. And half of the students come to the online class. So it's totally fine and it's a very common thing. So if you can't join the live sessions, don't worry. The recordings will be there for a long time. All of our mentors are Australian doctors. They are very much oriented with the guideline, the systems and everything. So you will be under a good care. If you want to start the enrollment, you can either contact me. So you must know my Facebook ID from First Aid AMC Clinical, or you can always contact us in this email. We have our website here. You can also, if you want to make payment and join the course, you can always go to this website and make the payment as well. So make sure to contact us. at least either send a message to me or send an email to here if you made the payment and you haven't got any other like information from us or no message from us in 2 days. Okay, so just let us know that you have made the payment, and then we'll ask you to do the next step. It's a simple process, but what we are doing at the moment, because still we have 2 weeks, like 2 or 3 weeks to start the course fully, we are adding the students in our portal, and portal we already started uploading some notes and videos of our last batch in that portal. So you can always join the course now. If you make the payment and get added in the portal, you can always like start going through some of the notes and recorded classes, which will give you a lot of ideas about AMC Clinical, and you can start your preparation right away. If you want to wait until the free 2-week sessions, please do that. We are more than okay with that. And definitely we would advise in that case, make sure you start reading the AMC Clinical Handbook so that you get to understand few things. All right. So that's pretty much everything I wanted to discuss for tonight. I hope you guys understood a little bit about clinical. Remember, clinical exam, just like your MCQ exam, most of you needed at least 2 months to even understand what it means. The same thing happens in clinical. You take at least 1 or 2 months even to understand, even to start your preparation. There is nothing you can do about it. That's how it is. It has been for everyone. So don't get frustrated easily. Just go with the flow. Just do what we ask you to finish. And after 1 or 2 months, you will know what to do. You will know the preparation, how to continue the preparation and everything. Okay. Yes, the notes will be provided, Dr. Sana. The MCQ class, so the MCQ trial class is next week, Saturday, Dr. Vivek, and it was going to start from 17th of January. And Shabab, the classes are online. We don't take face-to-face classes. All right, everyone. So I'm hoping that this is going to be a good journey with you. So we'll see you again on 15th of January when we'll start our free 2-week sessions. Take care, everyone, and definitely your thoughts should be straight that yes, I'm going to do it. I'm going to start the preparation, and then there is no going back. Remember, you are in the middle. There is no going back anymore. So you have to do it one way or another. So do it in the right way. Thanks, everyone. Have a good night. Take care. Bye.